If you are over the age of 60 and you think your annual blood work is telling you everything you need to know about your heart, your arteries, and your risk of a sudden cardiac event, I need you to stop right now and listen very carefully. Because what I'm about to tell you could be the most important health information you hear this year. A leading cardiologist is now saying publicly what many heart specialists have been whispering privately for years. The standard blood tests that most doctors order during your yearly checkup are not enough. They are missing critical warning signs that could tell you months or even years in advance that a heart attack or stroke is heading your way. And by the time those standard tests finally catch the problem, for many people it's already too late. The damage is done. The blockage is there. The event is happening. And families are left standing in hospital hallways asking the same devastating question. How did we not see this coming? The answer, according to this cardiologist, is simple and infuriating. You didn't see it coming because nobody ordered the right tests. Not because those tests don't exist. They do. Not because they're experimental or unproven. They're well established. But because the standard protocol that most doctors follow hasn't caught up with what modern cardiology actually knows. And that gap between what's available and what's being done is costing people their health, their independence, and their lives every single day. So right now, before you do anything else, I want you to commit to doing two things. First, stay with me for the next few minutes and learn exactly which 5 blood tests you need and why each one matters. And second, share this with every person over 60 that you know and love, because they deserve to have this information too. The test that saves their life might be one their doctor has never mentioned. Now let's get into this, because your heart is beating right now, and it has something to tell you if only someone would bother to listen. Let me introduce you to Dr. David Kaplan. Dr. Kaplan is a board-certified cardiologist who has practiced for over 30 years. He has treated thousands of patients, performed countless evaluations, and seen firsthand what happens when heart disease is caught too late. But in recent years, Dr. Kaplan has become increasingly vocal about something that troubles him deeply, and it's the fact that the blood tests most doctors rely on are only showing part of the picture. He compares it to trying to predict the weather by only looking at the temperature. Sure, temperature matters, but if you ignore humidity, wind speed, barometric pressure, and cloud patterns, you're going to be caught in a lot of storms you didn't see coming. And when it comes to your cardiovascular health, getting caught in a storm can mean a heart attack, a stroke, or sudden cardiac death. Dr. Kaplan says that when most people over 60 go in for their annual physical, their doctor orders what he calls the basics. A standard lipid panel that measures total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. Maybe a fasting glucose test. Maybe a basic metabolic panel. And when those numbers come back within normal ranges, the doctor says everything looks good, see you next year, and the patient walks out feeling reassured. But Dr. Kaplan says that reassurance is often dangerously premature, because those standard tests, while useful, are missing crucial pieces of information that could reveal hidden cardiovascular risk lurking beneath perfectly normal-looking numbers. He tells the story of a patient named Frank to illustrate his point, and Frank's story is one that I think will stay with you. Frank was 67 years old, a retired postal worker who walked 3 miles every day, ate a reasonably healthy diet, and never smoked. He went to his doctor every year like clockwork, and every year his blood work came back looking fine. His total cholesterol was within range. His LDL was a little elevated, but nothing his doctor was worried about. His blood sugar was normal. His blood pressure was well controlled with a low-dose medication. On paper, Frank was the picture of a healthy senior. His doctor told him he was doing great. Frank believed him. Why wouldn't he? Then one Saturday afternoon, while Frank was mowing his lawn, he felt a crushing pain in his chest that dropped him to his knees. His neighbor saw him collapse and called an ambulance. Frank was having a massive heart attack caused by a 90% blockage in his left anterior descending artery, the artery that cardiologists grimly refer to as the widowmaker. Frank survived, but only because the ambulance arrived quickly and the hospital was able to perform emergency surgery. When Frank recovered enough to talk, The first thing he asked his cardiologist was how this could have happened when all his blood work was normal. And his cardiologist, who happened to be Dr. Kaplan, looked him in the eye and said that his blood work was normal for the tests that were ordered. But there were other tests, tests that Frank's primary care doctor had never ordered, that would have revealed the danger hiding in Frank's arteries long before that Saturday afternoon. That conversation changed Frank's life, and it changed Dr. Kaplan's approach to patient care forever. Since then, Dr. Kaplan has been on a mission to educate both doctors and patients about 5 specific blood tests that he believes every person over 60 should have done at least once a year. These are not exotic or expensive tests. They are widely available, covered by most insurance plans, and can be ordered by any doctor. But most doctors don't order them unless a patient specifically asks. And most patients don't ask because they don't know these tests exist. So let's go through them one by one, and I'm going to explain not just what each test measures, but why it matters so much for your health, and what it can reveal that standard blood work completely misses. The first test that Dr. Kaplan says is absolutely essential is called a high-sensitivity C-reactive protein test, often written as HSCRP. Now, you may have heard of C-reactive protein before, but the high-sensitivity version is different from the standard CRP test that doctors sometimes order when they suspect an infection or acute inflammation. The high-sensitivity version is specifically designed to detect very low levels of chronic inflammation in your body, and here's why that matters so much for your heart. We now know that heart disease is fundamentally a disease of inflammation. The plaques that build up in your arteries and eventually cause heart attacks and strokes are not just passive deposits of cholesterol sitting on the walls of your blood vessels. They are active, inflamed lesions that grow, change, and can rupture without warning. When a plaque ruptures, it triggers a blood clot that can completely block the artery, cutting off blood flow to your heart or brain. And the likelihood of a plaque rupturing is directly related to how inflamed it is. A highly inflamed plaque is an unstable plaque, and an unstable plaque is a ticking time bomb. The HSCRP test measures the level of this inflammation in your bloodstream. A person can have perfectly normal cholesterol numbers and still have dangerously elevated HSCRP, which means their arteries are inflamed and their plaques are unstable and prone to rupture. This is exactly what was happening with Frank. His cholesterol looked fine, but his inflammation levels were through the roof. If someone had ordered an HSCRP test at any point during his years of normal blood work, the elevated result would have been a red flag that prompted further investigation, possibly imaging of his arteries, and his 90% blockage could have been discovered and treated before it nearly killed him on his front lawn. Dr. Kaplan says that HSCRP is one of the strongest predictors of future cardiovascular events that we have, and yet the majority of primary care doctors don't include it in their routine blood work for seniors. He finds this inexcusable, and frankly, so do I. The second test that Dr. Kaplan insists on is called a lipoprotein AA test, which is usually written as LPA and pronounced lipoprotein a. This is a test that most people have never heard of, and many doctors rarely order, but cardiologists consider it one of the most important genetic risk factors for heart disease and stroke. Lipoprotein A is a type of cholesterol particle that is determined almost entirely by your genetics. Unlike regular LDL cholesterol, which can be significantly influenced by diet, exercise, and medication, your LPA level is something you're born with, and it stays relatively constant throughout your life. Here's why it matters. LPA is extremely effective at promoting plaque buildup in arteries and at making blood more likely to clot. People with high LPA levels have a significantly increased risk of heart attack, stroke, and aortic valve disease, even if all their other cholesterol numbers are perfectly normal. And this is the crucial point. A standard lipid panel does not measure LPA. You could have a dangerously elevated LPA level and never know it unless someone specifically orders the test. Your total cholesterol could be ideal, your LDL could be in a healthy range, and underneath those reassuring numbers, LPA could be silently accelerating the clogging of your arteries at a rate that nobody is detecting. Dr. Kaplan recommends that every person should have their LPA measured at least once in their lifetime, and ideally it should be done before the age of 60 so that appropriate preventive measures can be started early. But for anyone over 60 who has never had this test, getting it done now is still critically important. If your LPA is elevated, your cardiologist can adjust your treatment plan accordingly, potentially adding medications or intensifying preventive strategies that could significantly reduce your risk. But none of that can happen if nobody orders the test. The third blood test on Dr. Kaplan's essential list is something called a B-type natriuretic peptide test, commonly referred to as BNP or sometimes NT-proBNP. This test measures a hormone that is released by your heart when it's under stress, specifically when the walls of your heart are being stretched more than they should be. In simple terms, BNP is your heart's way of sending out a distress signal. When the level is elevated, it means your heart is struggling, and the higher the level, the more it's struggling. Why is this test so important for people over 60? Because heart failure, which is a condition where the heart gradually becomes too weak to pump blood efficiently, is incredibly common in older adults and is often developing silently for years before symptoms become obvious. By the time most people notice symptoms of heart failure, shortness of breath, swelling in the legs, fatigue, difficulty climbing stairs, the condition has already progressed significantly. But a BNP test can detect the early stages of heart failure long before those symptoms appear. It can catch the problem when it's still in a stage where treatment can slow or even stop the progression. Dr. Kaplan says he has had patients walk into his office feeling perfectly fine, with no complaints whatsoever, whose BNP levels revealed that their hearts were already showing signs of failure. Because he caught it early, he was able to start treatment that preserved their heart function and kept them out of the hospital. But he also says that for every patient he catches early, there are countless others whose doctors never ordered the test, who didn't find out about their heart failure until they ended up in the emergency room, gasping for breath. Early detection through a simple blood test versus emergency hospitalization and permanent heart damage. The difference is literally one test that costs a fraction of what a hospital stay costs. The fourth test that Dr. Kaplan considers essential is a comprehensive thyroid panel. And I can almost hear some of you wondering what the thyroid has to do with your heart. The answer is everything. Your thyroid gland, that small butterfly-shaped gland at the base of your neck, controls your metabolism, and your metabolism directly affects how your heart functions. When your thyroid is underactive, a condition called hypothyroidism that becomes increasingly common with age, it can cause your heart rate to slow down, your cholesterol to rise, your blood pressure to increase, and fluid to build up around your heart. When your thyroid is overactive, a condition called hyperthyroidism, it can cause your heart to beat too fast, trigger dangerous arrhythmias like atrial fibrillation, and increase your risk of stroke and heart failure. Here's the problem. Many doctors only order a TSH test, which measures thyroid-stimulating hormone. And while TSH is a useful screening tool, it doesn't tell the whole story. A person can have a normal TSH level and still have thyroid dysfunction that's affecting their heart. A comprehensive thyroid panel includes not just TSH, but also free T3, free T4, and thyroid antibodies. These additional markers can reveal subclinical thyroid problems, meaning problems that haven't yet caused the TSH to go clearly out of range, but are still significant enough to impact cardiovascular health. Dr. Kaplan has seen patients with puzzling cardiac symptoms, unexplained arrhythmias, resistant high blood pressure, cholesterol that won't respond to medication, whose underlying thyroid dysfunction was only discovered when a comprehensive panel was finally ordered after years of normal TSH results. Treating the thyroid problem resolved or significantly improved their cardiac symptoms. But for those years when nobody looked beyond the basic TSH, their hearts were being damaged by a treatable condition that was flying under the radar. The fifth and final test on Dr. Kaplan's list is one that might be the most overlooked of all, and it's called a hemoglobin A1C test combined with a fasting insulin level. Now, many people have heard of A1C, particularly those who have been diagnosed with diabetes. A1C measures your average blood sugar over the past 2 to 3 months, which gives a much better picture of your blood sugar control than a single fasting glucose measurement. But what most people don't know is that A1C is critically important, even for people who have not been diagnosed with diabetes, because it can reveal a condition called prediabetes that affects an enormous number of seniors and dramatically increases cardiovascular risk. Prediabetes means your blood sugar is higher than normal but not yet high enough to be classified as diabetes. It's a warning stage, a window of opportunity where aggressive lifestyle changes and sometimes medication can prevent the progression to full diabetes. But here's the cardiovascular connection that makes this so urgent. Prediabetes itself, even before it becomes diabetes, significantly increases your risk of heart disease and stroke. The elevated blood sugar damages your blood vessel walls, promotes inflammation, accelerates plaque formation, and makes your blood more prone to clotting. People with prediabetes have a cardiovascular risk that is substantially higher than people with normal blood sugar, and yet many of them have no idea they're in this danger zone because a single fasting glucose test can miss prediabetes entirely. A fasting glucose test only captures your blood sugar at one moment in time. If you happen to eat well the day before your blood work, or if your body managed to bring your glucose down to a normal level by morning through an overproduction of insulin, your fasting glucose might look perfectly fine, even though your average blood sugar over the past 3 months has been elevated. That's why A1C is so much more reliable. It doesn't let one good day mask months of hidden problems. And the fasting insulin level adds yet another dimension. You can have a normal fasting glucose and even a relatively normal A1C, but have an elevated fasting insulin level, which indicates that your body is producing excessive amounts of insulin to keep your blood sugar in check. This is called insulin resistance, and it's one of the earliest warning signs that your metabolic health is deteriorating. Insulin resistance is a powerful risk factor for heart disease, and it can be present for years or even decades before blood sugar levels become obviously abnormal. By measuring fasting insulin, your doctor can catch this problem in its earliest stages and intervene before it progresses to prediabetes, diabetes, and the cascade of cardiovascular damage that follows. Dr. Kaplan says that when he orders these 5 tests for his patients over 60, nearly half of them have at least one result that reveals a hidden risk that was completely invisible on their standard blood work. Nearly half. Think about that number. That means roughly 1 out of every 2 seniors walking around with a clean bill of health from their annual physical actually has an undetected cardiovascular risk factor that could be identified and treated if someone simply ordered the right test. That's not a small gap in our healthcare system. That's a chasm, and people are falling into it every day. Now, I want to address something that I know some of you might be feeling right now, and that's a sense of frustration or even anger that your doctor hasn't ordered these tests. I understand that feeling, and I think it's valid. But I also want to be fair to the doctors who are doing their best within a system that isn't always set up to support the most thorough care. Primary care doctors are under enormous pressure. They often have 15 or 20 minutes per appointment. They're following protocols that were established years ago and that haven't been updated to reflect the latest cardiovascular research. Many of them are aware of these tests but don't order them routinely because insurance coverage can vary and they don't want to burden patients with unexpected costs. And some of them honestly are simply not aware of how important these specific tests have become in modern cardiovascular risk assessment. That's why Dr. Kaplan says the most powerful thing you can do for your health is to become your own advocate. Don't wait for your doctor to suggest these tests. Ask for them. Walk into your next appointment with a list. Write down the names: HSCRP, LPA, BNP or NT-proBNP, comprehensive thyroid panel, and hemoglobin A1C with fasting insulin. Hand that list to your doctor and say you'd like these tests ordered. Any good doctor will be happy to discuss them with you, and most will agree to order them once they understand why you're asking. If your doctor is resistant or dismissive, Dr. Kaplan says that's a sign you might need to find a doctor who takes a more proactive approach to your cardiovascular health. Let me share one more story with you before I close because I think it brings everything together. A woman named Dorothy, 73 years old, heard about these 5 tests from a friend who had listened to a presentation similar to what you're hearing right now. Dorothy had been going to the same doctor for over a decade, and her blood work had always been normal. She felt fine. She had no symptoms. But something about what her friend told her stuck with her, and she decided to ask for the test at her next appointment. Her doctor agreed, and a week later, Dorothy got a phone call that changed her life. Her HSCRP was significantly elevated, indicating serious arterial inflammation. Her LPA was extremely high, putting her in a high-risk genetic category. Her A1C revealed that she was pre-diabetic, something her fasting glucose had never shown. Her regular cholesterol numbers were still perfectly normal. Without those additional tests, Dorothy would have continued walking around thinking she was healthy, while three major risk factors silently converged toward a cardiovascular catastrophe. Because she asked for the tests, Dorothy's doctor referred her to a cardiologist who ordered imaging of her arteries and found significant plaque buildup that was not yet causing symptoms but was progressing toward dangerous levels. Dorothy was started on an aggressive prevention plan that included medication adjustments, dietary changes, an exercise program tailored to her needs, and close monitoring. A year later, her inflammation markers had dropped substantially. Her A1C was back in the normal range, and the progression of plaque in her arteries had been halted. Dorothy tells everyone she knows that those 5 blood tests probably saved her life, and she might be right. So here's what I want you to take away from everything you've heard today. If you are over 60, your standard blood work is not enough. It is showing you some of the picture, but it is leaving out critical details that could mean the difference between prevention and emergency. There are 5 tests that every person over 60 should be asking for, and those tests are the high-sensitivity C-reactive protein, lipoprotein or EA, B-type natriuretic peptide, comprehensive thyroid panel, and hemoglobin A1C with fasting insulin. Together, these tests give your doctor a far more complete picture of your cardiovascular health and can reveal hidden dangers that standard blood work completely misses. Please make the call, schedule the appointment, ask for the tests, and then share this information with everyone you know who is over 60 because the people you love deserve to know what their blood is trying to tell them. Don't let another year go by with false reassurance from incomplete testing. Don't become another Frank who finds out about his blockage on his front lawn, or another Walter whose stroke could have been prevented, or another story that a cardiologist tells at a conference to illustrate what happens when we don't look hard enough. You have one heart. It has been with you since before you were born, beating faithfully every second of every day, and it is asking you for one simple thing. Listen to it. Test it properly. Give it the attention it deserves, and it will keep beating for you for a long, long time to come. Your next step is simple. Pick up the phone, call your doctor's office, and say these words. I want to talk about my cardiovascular blood work, and there are 5 specific tests I'd like to discuss. That one phone call could be the most important thing you do for your health this year. Don't wait. Don't put it off. Do it today. Because your heart is talking to you right now, and it's time to start listening.